Hi there, it's Jen Edge here. I am talking to you today coming to you from the Dubbo Specialist and Rehabilitation Centre on 205 Darling Street. And I've got a few questions for you. Have you ever been in pain? Yes, me too. And if you've had an injury, you just want the pain to go away and to be back living life as you normally do, right? No injury, no pain, no restrictions. So that's why I'm talking to you today. I'm talking to you today about acupuncture and dry needling and how they can help you to do that. They're fantastic tools to help you to recover from injury faster, reduce pain, improve function, and heal faster. So I'm going to be just talking to you about the difference between the two and also what exactly does it involve. So for those of you who haven't met me before, my name is Jen Edge and I'm a physiotherapist and life coach, and I run the business Physio Wellness, which is located inside the Dubbo Specialist and Rehabilitation Centre. So today I'm going to be talking to you about the differences between acupuncture and dry needling, and I've actually got some needles here as well to show you in case you haven't seen them before and don't really know what it's all about. And just showing you a little bit about those needles as well, and telling you how great they are as part of the treatment that you can get from a physiotherapist. So let's have a quick talk about why you would do this. Well, because I've seen a lot of patients over the years of being a physio, probably over 3,000 patients, and I didn't, when you come out of uni, you don't necessarily learn these skills of acupuncture or dry needling, and may have heard about it but don't really know what it's all about. And it's something that you learn along the way if you have a particular interest in that area. And I found that it is really effective with helping people to reduce their pain, to improve the healing process, and basically get them back at functioning as normal as quickly as possible. And excuse me. So I came to start studying acupuncture when I was working over in England, and it came up as an opportunity to actually study an acupuncture course. It was a short course, so I am not an acupuncturist, and I would never call myself an acupuncturist because that requires a lot more study and into traditional Chinese medicine, and so I would never call myself that. I'm a physiotherapist that does acupuncture for pain relief and for headache relief. I don't know how to help you with your asthma from an acupuncture point of view. I can do breathing techniques with you, but not specifically for acupuncture. I don't know how to improve your fertility. I don't know how to help you with anything apart from any of those things that I know acupuncturists can be really helpful with. But yeah, I just wasn't trained in that way. So I discovered, I started studying acupuncture and became interested in that and dry needling just as a result of working with patients, and I think I just wanted something else to be able to help my patients get better results, basically. So I started becoming interested in this and started using it as a treatment technique. And I found that a lot of patients are getting fantastic results as a result of doing this type of treatment. And if you've had it, I'd love to hear your experiences as well. So if you have actually had acupuncture in the past or dry needling, then if it did you some good, then I'd love to hear all about it. So, and I do know that I moved to Dubbo from Sydney in February of 2019, so February this year. And I do know that just for a change, right? I just wanted to get out of Sydney for a while and just have a change of scenery. And I think that, and this was a good opportunity to do that, and bring my skills with me. And I know that there are quite a few therapists in the area that do dry needling. And I know that there are acupuncturists as well. So it's just being able to, I think, figure out what works best for the patient. So it could be a combination of acupuncture and dry needling, which I do actually do. I don't necessarily just do one or the other. A lot of the time I'll do a combination of the two in a session, and then also doing some manual therapy if it's indicated, which is just some potentially a little bit of muscle releasing. And then also some joint movements or what we call mobilizations as well. And then generally, most of my patients will end up with some form of exercises as well, because I think that it's a really great way to just round out the treatment and have that holistic approach. I just started really becoming interested in the holistic approach, and I feel like acupuncture and dry needling is a really important key to that, because when we think about a person, it's not just their injury. It's not just, say, their knee pain or their shoulder pain or their back pain that is causing all of their dysfunctions in life, but understanding that it doesn't happen alone. It impacts other areas of the body physically, but also can have an impact on people emotionally and mentally as well, and impacts many different areas of their lives, their relationships, potentially their ability to work, so their finances, their ability to exercise or stay active or do the things that they love, and you can see how that would affect so many areas of their lives. So that's why I love this holistic approach and looking for different ways to be able to help my patients to actually get relief from pain, to heal whatever it is that they're struggling, whatever injury they have or their pain, and get back to doing whatever it is that they love and whatever they do best. And basically, I just say that, that is getting you back to doing, living and doing life better. So when we talk about, let's talk about dry needling first. So, or what it is and why is it such a good idea? Why are acupuncture and dry needling such a great idea for as part of your treatment? Well, when we look at the type of pain, a lot of pain is what we call myofascial. So it could be the fascia or the connective tissue, and also the muscles as well. The muscle part of your body, the musculars, the muscles, and it's a really common form of pain in the body. And what can tend to happen as well is you can actually form these trigger points. And a lot of people have heard of these myofascial trigger points. It can be those really sore spots and tight spots that people press on. These are the upper traps here, are some classics of where a lot of people get these trigger points coming up as well. But pretty much, there are hundreds of trigger points potentially all over your body. Depending on if it's if it's an overused muscle, if it's not a happy muscle, as they say, then you can potentially end up with trigger points in those muscles. And generally, they're tender. When you press on them, they're quite tight or taut bands of muscle. And what will tend to happen is a lot of the time you can get a referred pain from these particular trigger points. So when we talk about referred pain, it doesn't always have to be the nerves that are referring. It can actually be the muscles as well, and these trigger points can be referring. And you also get, when you press on them, you'll tend to get this sort of what we call a local twitch response. A local twitch response. It's actually quite hard to say. And you'll actually get that response as well in that local area. So they've actually found, I was just looking up some research, because some people really love numbers, right? I'm a bit of a numbers person. So they've done studies in the US and have shown that these myofascial trigger points were the primary source of pain in 30 to 85% of patients. And really finding that a lot of the time these trigger points go undiagnosed by either doctors or physiotherapists as well, which obviously can then lead to chronic conditions as well. So we want to try and avoid chronic anything if we can, chronic illness or chronic pain, and try and address it when it's there. So basically we want to try and do these techniques to try and help people get better faster. So we talk about the dry needling. Dry needling is evidence-based. It's based on science. It's more Western medicine based, and basically it helps with lots of different things in the body. But it does have it's more based on a medical sort of model, an Eastern medicine. Western medicine. Whereas acupuncture, there are different types of acupuncture as well. There is traditional Chinese medicine acupuncture or Eastern acupuncture, and also Western or medical acupuncture. Excuse me. And the Eastern acupuncture, so the traditional Chinese medicine acupuncture, which is what I learned, is actually it goes back thousands of years, and it has these roots in the Eastern in China. And can be very, very effective. but it's not so much based on on these trigger points. Okay, it's more based on restoring what they call chi, or energy in the body, and it's restoring this balance of energy and this flow of energy through the body. It talks about meridians. I don't know if you've heard of meridians before, but they're basically channels in the body that run throughout the body, up and down the arms, the front, the back, the sides, and they run up and down the body just as the nervous system does. So it actually is quite closely related to where the nerves run in the body as well, and also the connective tissue too. So if you look at if you're to look at some of these posters that you see around about the nervous system in the body, the meridians actually have a similar formation as well in the body. So it's not just randomly drawn, random meridians or random lines. It does actually have this close affiliation with the nervous system and the fascial system as well. So basically what we're doing with doing the needles with acupuncture is we're trying to restore this flow of chi, or this flow of energy throughout the body. And basically what we're talking about there is we're saying that, okay, there's a blockage of chi, or there's an imbalance in chi or energy. So we want to restore that balance. And so you potentially will be putting needles into areas that someone might say, oh, well, I've got shoulder pain. So for example, if someone had shoulder pain or forearm pain, I would actually be potentially putting a needle, or at least one needle, into their hand. Depending on whether they're male or female will also depend on which hand as well. So it's not so I suppose evidence-based as in scientific Western science, but there is a lot of evidence over the thousands of years that it's been around that how effective it can be. So basically what you're doing there is there are a number of points along these meridians that are that we were taught that are effective for alleviating certain types of pain, or for treating certain ailments. So with the shoulder, you would potentially put some around the shoulder, maybe in the opposite arm and into the hand, depending on obviously the type of pain that they're having, the injury, or and also whether they're male or female as well. And this is just my experience, okay? So if you have experience with TCM or traditional Chinese medicine, and you are trained as an acupuncturist, this is what I learnt, and I'm really hoping that this is in line with what you learnt as well. And I'm confident that it is, because it was a fantastic course that I learnt and just gained so much knowledge from it. So basically that's what we do, and as a physio, this was directed for the needles were for pain relief and for headache relief as well. As I said, I'm not treating anything else potentially with the acupuncture. It's just pain and for headaches. And then Western acupuncture is more of a therapeutic adaptation of this traditional treatment. And it uses more of the anatomy and the physiology and the current medical models, as opposed to the traditional acupuncture. So slightly different. And but what I found is that that both of these types of, like, whether it's acupuncture or whether it's dry needling, they're pretty much trying to get a similar result, right? They're trying to get the same result. They're trying to relieve pain and get the person back functioning as quickly as possible. With this type of acupuncture that I learned. So you can treat it, tension headaches are really great with needling as well, muscle spasms, relieving tightness, back pain, neck pain. I've had a lot of people with forearm pain, so whether we call it tennis elbow or golfer's elbow, shoulder pain, knee pain as well. Any muscle sort of tension or tightness or discomfort can be treated with needles as well. I've actually also done in the more recent course that I did, which was the dry needling. We also were shown how to that you can actually put needles into swollen ankles as well. If it's quite acute, or a recent ankle injury and it's swollen, you can actually put the needles in there in certain points as well to alleviate some of that swelling, which is great. And again, these are not, I wouldn't use these as standalone treatments. I use them in conjunction with other things that I do as well. Because I'm not a Chinese medicine traditional Chinese medicine acupuncturist, whereas that's a lot of the time that's all they do from my experience of going to see them. They may do that and maybe some herbs or different sorts of things like that, but they won't. I have a very different approach to treatment. So let's just go over some of the benefits of acupuncture and dry needling. So, as I said, reduction of pain, which is always number one on my list. I think no one wants to be in pain. Everyone wants to get out of pain as quickly as possible. Reducing muscle spasm or tension, increasing range of motion, facilitating a healing response, the healing process as well, which is fantastic. So we want to try and get the body into the best sort of state to promote healing, and acupuncture and dry needling really does this fantastically. You also get this relaxation response in the body too, which is great. Almost all of my clients will say how relaxed they are just by lying there with needles in, which is just amazing. I find that just such a fantastic sort of I suppose not a side effect of treatment, but part of the treatment process, which is great. Also, can actually help to improve your sleep as well. And I don't directly try an acupuncture to improve sleep, but you can see that there's a link there between improving sleep and also decreasing pain as well, right? Like if your sleep is disrupted because of pain, then you can see that if you're doing acupuncture, it can help with that too. So the thing with the needles as well is they act, obviously, if we're putting, say, in the forearm, right? They're acting locally in the muscle, but they're also acting, if you think about, there's a message being sent from here to the spinal cord up to the brain. So you're getting an action here, some sort of reaction here, but also in the spinal cord, and then also up in the brain as well. So you're getting this sort of local, regional, and then I suppose you'd call general sort of response from those areas too. And they are, so I've just sort of written down a few things that are happening along these, so you're activating neural pathways, which is always, which is something that really helps to take care of pain as well. So you're also locally, you're also releasing things, and up in the brain as well. So you're releasing opioids, okay, so what are called opioid peptides, serotonin, which most people are aware that's that happy drug, right? That's the feel good drug. That gets released by the body. Histamine, blood flow is increased as well. Excuse me. Endorphins are released. Melanin, cortisol, thyroxine, estrogen. So lots of things are happening just by putting needles into your body, which is pretty amazing how your body reacts to that in such a positive way. Okay, so what we're looking at here, if we talk about acupuncture, I talked about this qi, right? This energy in the body. And a lot of the time with certain acupuncture points that I put in, you will be looking for what's called de qi, which is this dull ache. Especially if you ever get one put into this area here, that is quite an intense dull ache that you would feel that particular the particular sensation, and you're looking for that on certain points. That's to act like an activation of the qi. Whereas with dry needling, you're actually looking for other things as well. And in the course that I did, you actually learn a number of different levels that you would go deeper and also turning the needle and doing things and trying to go for a twitch response as well. So there's levels of depth and intensity that you would do with the dry needling. So the dry needling is where I would go directly into a muscle. Now, it's hard to demonstrate on, there's a great muscle in the forearm here, which you can do it on, but I need to be able to actually have two hands. So what I'm going to do today, though, is I am going to demonstrate actually putting a needle in, and give you a look at what the needles look like as well. So basically what you're looking for, I'll just show you one of the needles. Okay, so basically this is one of the needles. This is, so it's very, very, I'll just take it out of the thing. I'm not going to use this one, obviously, but I don't even think you can see. Oh yeah, there you can see that. So very, very small, and it doesn't put anything into the body. There's no hole in it that like you would normally, or take anything out. It's just the needle, but very, very small. So you can appreciate that is, you're not going to have a huge sensation, like feeling from that, I suppose. Can be a little uncomfortable when it goes in, but pretty okay. So that's 30 mils long, that one. Ow. We will put that down. Okay, and then you've got this one is 50 mils. So I just caught myself with the little guide tube there. This is called a guide tube, okay? And this is your needle here. So basically, you would use a guide tube to help you actually put the needle into the skin. So you've got, that's a 50 mil needle, so slightly longer. And then you've got, and there's other ones as well. I've got shorter ones, but these are the main ones that I use. And this is a 70 mil, so this is quite a lot longer. So I'll show you how long that one is. That's quite a lot longer, that one. You can see that hopefully. And that one goes more into like buttocks, so glutes are the main area that I tend to use that on. Like you don't really use it on many other places or anywhere else. Okay, so that's basically a look at the needles. They're all single use. Okay, you would not use these again after having used them on one person. They get put into what's called a sharps bin, and then they get thrown out. They don't get reused. They're sterilized, single-use needles. They're made of metal. So these ones are, and yeah, so very good quality needles that I buy. But yeah, so very safe in that regards. So. And just appreciating as well that regarding your reactions when if you're having any needling done, that everyone will react differently to the needles. Okay, so just appreciating that. Yeah, when I'm treating people as well, I don't necessarily go like really hard, really quickly, because I don't know how your body is going to react. So when I am putting needles in, I don't leave them for sort of 20 minutes to start with. I tend to start quite low, so say 5 to 7 minutes, and I won't have a huge amount of intensity. If I'm doing dry needling, I'm not going to sort of ramp it up and have a really big reaction in that area, in the forearm, because I don't know how your body's going to react to it. And because there are obviously some potential side effects from needling, like some people can get bruising, some people can get a bit of maybe even an aggravation of the symptoms, but generally it's pretty low. It's like 3%, right? Really, really low. Some people can get a little bit of pain where the needle was, and even some people can get a bit of drowsiness or dizziness, and just other sort of pretty mild generally, sort of adverse effects, but most people get fantastic benefit, which is really great. So I'm going to show you, I'm just going to put some antibacterial gel onto my hands so that now you don't have to, when you're actually having the needles put into your body, as long as it's clean, it doesn't have to be like, sort of use an alcohol wipe unless you're doing the ear. But I would only do that with someone that is really trained well in acupuncture or dry needling to do the ear. I don't do the ear because I haven't practiced it. So it's quite a sensitive area to do. So I'm going to do a demo for you. So I'm going to do it into this spot here that I talked about, okay? Because this is an acupuncture point. I haven't done this one for dry needling and didn't learn this one in dry needling, but this is an important acupuncture point. For any pain in the upper body, I pretty much 99% of the time will do one in the hand, unless someone has some, what we call contraindication, so a reason why I wouldn't do it. And there are some people that can't have acupuncture. There are a number of different illnesses or diseases, or if they have conditions that we cannot do acupuncture on them. But just ask, obviously your physio will know that, and or your acupuncturist, and they'll be able to make sure that they're doing it very, very safely. This is a very safe, if you're going to someone that's trained, then it is a very safe type of treatment. So I just want to stress that as well. Okay, so I'm going to basically just, I've got the needle there, I've got the guide tube, and I've just let that go. I'm hoping you can see that. All right, and then I'm just going to tap the needle in. Normally, I would not do this. They say don't needle yourself, so I'm not going to actually put it like in and do anything with it, but I've literally just put it in the skin. That's it. Okay, so normally I do not needle myself, and do not try this at home. But that's pretty much it. So yeah, and then I did forget something. So I would generally then use, if either I've got a glove on one hand on the hand that I'm taking out, or I'd use a cotton wool ball and take that out as well. Okay, put that straight into the sharp spin. I should have, I'm very sorry, had that sharp spin right here, but there it is there. So that's your sharp spin, and you put that straight into there, so that there's no risk of contamination or anything like that, of infection. So that's pretty much it. I hope you enjoyed that and hope you found that useful. Yeah, just don't go around trying to, obviously making sure that you're going to a professional that knows what they're doing with the needles. But if you haven't tried dry needling or acupuncture in the past, try it out. I think it's a really great way to actually alleviate pain, improve function, as I said, I think about 10 times now. I really love the relaxation response that acupuncture has as well. It's a nice added bonus, I think, from the needling, and also, I mean, I've learnt some relaxation, specifically relaxation needle points as well for acupuncture, so you can actually, it gets a really nice way to help people to relax and just calm their nervous system. I think is a really nice way to do that as well. So if you do have any questions, please don't hesitate to contact me. You can do that through the Dubbo Specialist and Rehabilitation Facebook page. Leave comments, or like or share if you got something out of this video today. Otherwise, you can contact me through the clinic on the phone here. It's 6885-1696, or you can get me on my own page as well, which is Physio Wellness Dubbo. So that's the Facebook page. Okay, well, it was lovely to speak to you all today. I hope you have a fantastic afternoon, and I will talk to you very soon. Bye.